Welcome to Fields of Study from the Masonic Cancer Center. Today we sit down with Kiara Ellis, Senior Manager of the Office of Community Outreach and Engagement for the Masonic Cancer Center. Hello everyone and welcome. My name is Max Huber and you are watching Fields of Study, a video series from the Masonic Cancer Center. In this video series, we sit down with some of our faculty, staff, researchers, nurses, people that represent the Masonic Cancer Center throughout the state of Minnesota and get to learn a little more about them and how they've adjusted to the current situation that we're faced with coronavirus, COVID-19, civil changes that we're seeing throughout the country. And today I am very pleased to be joined by one of my colleagues, a person that I shared an office with for like my first year on the job, Kiara Ellis, the Senior Manager of Community Outreach and Engagement. Kiara, thank you so much for joining me.
Thanks for having me.
Yeah, it is my pleasure. You guys are kind of the outward-facing arm of the Masonic Cancer Center. You know, we do have researchers that go out and present to people, but maybe the boots on the ground is what we like to call community outreach and engagement. Not the best descriptor, but tell us, what is this group and what do they do at the Masonic Cancer Center?
No, I think that is exactly it. Our team is responsible for bringing the research that's happening in the community the research that's happening in the labs out into the community in a way that's really tangible and accessible. We also want to make sure that we're creating pathways for the community to influence the way that we conduct research and what's important to observe. We understand that, community does know best in some respects around their health and what's affecting their communities most. And so we want to make sure we're giving voice to that. So we're really the folks that are in between the Cancer Center and community, helping spread the word about cancer in different areas.
Yeah, and I spoke with Dr. Glenn Simmons Jr. yesterday, and one of the things he talked about was health disparities and not being able to convey the same message from this group to this group. Sometimes it's just culturally, whether it's the African American community, whether it's the Somali community, the Hmong community, the white community, there's a difference that way to approach cancer research and sharing that information. So how does your group go about doing that?
Yeah, we really believe in meeting our community where they're at. There's a long-standing history and trauma of research, trouble in research ethics. And so a lot of communities are weary of research. So coming out as the University of Minnesota, representing an amazing research institution, there is already hesitancy from communities. So we really spend the time building relationships and making sure that we're providing a service or education that really empowers the community to be an active participant in their health, whether that's in care, in accessing education, or being a caregiver. It's really important for us to make sure that communities grow to trust the Cancer Center and understand that our message is really to be of service to the community as the university is. There are lots of different cultures that have viewed preventative care in their home countries before coming into the U.S. Very differently. And so you only go to the doctor when you're sick. So changing the way that we frame and message our education to tailor to community is very important, in making sure that we find buy-in from leaders that are really interested in helping us change the way that folks view their cancer health and risk, and making it culturally appropriate. In some languages, there's not even a word for cancer. So starting with some real basics for people is exactly where they're at and what they need. And if they go into an institution for healthcare services of any kind, we want people to be confident that they know what they're asking for or what to expect, so that they, stay healthy for their families.
Yeah, and one of the other things that the Masonic Cancer is all about is not just Minneapolis, St. Paul, the Twin Cities, but our area of influence is the entire state of Minnesota, and that's a very different and varying population. Somebody that's based in the Twin Cities versus somebody that's based in like International Falls. So how has the group dealt with that challenge?
Yeah. So for our rural populations, which a lot of Minnesota is, it's expanding programs like our partners with the Minnesota Cancer Clinical Trials Network and addressing the way that what barriers limit people from engaging in cancer care. So providing more access, being of resource, and now, during COVID, in the age of all of this virtual technology, providing some of those resources, seminars, and things that folks in the Twin Cities are able to easily access, online, and making things self-paced so folks can engage and learn at the same pace as we are. We also have a cancer information line that's staffed by a nurse, weekdays 9 to 5, and she is a great resource for caregivers, for community clinics and professionals in those areas, to gain access to the resources that the university has to offer.
Yeah, and you did mention COVID-19, and that's dealt us a weird hand here in 2020.
Mm-hmm.
And one of the ways that the Masonic Cancer Center and community outreach and engagement would reach a number of people throughout the summer and other things was events. Minnesota State Fair, Farm Fest, Rondo Days, all these different events, and now all of a sudden it's just nothing. Not able to do it. I was actually looking forward to the State Fair, getting out there and mingling with some people, and now a lot of that has been canceled. So we're in this weird situation. And how has the group kind of adapted to that, and knowing that a lot of your touch points were out in the community, a lot of
Mm-hmm.
that has been taken away?
Yeah, it's really tough. We are community folks at our heart. Our entire team are all folks that are used to being in community. So this is a bit painful for us to be so isolated from members and our partners and community organizations. What we've tried to do is maintain those partnerships and checking in with folks. A lot of our nonprofit community partners that work with folks are furloughed or had staffing changes because of COVID-19. And so we've tried to remain engaged in providing resource or access where we can. One thing that we did start doing are 2 community engagement coordinators that are on the ground delivering education to communities, have been volunteering with some of the food shelves and food service providers that are delivering food in a time of need during this pandemic to folks that are struggling with food insecurities. So while we're there volunteering, they're also giving out education about cancer fighting foods and how to manage diet and nutrition and its impact on cancer, or reminders about screening, that even though COVID is happening and we kind of have these uncharted territories, we really do need to still think about those preventative screenings and different things that we need to do. So it's tough for sure, but we're trying to engage as much as we can, and definitely staying present in our partnerships is something that we've been doing.
Yeah, and you can see some of that on our social media channels. We've shared photos of Abdi, one of the outreach coordinators, like you said, who was volunteering at
Mm-hmm.
Afro Deli, and Sylvette, who's been like volunteering. I can't even keep track of all the emails she's been sending me, but she's been out. This is one of the things we've talked about at the Masonic Cancer Center is cancer doesn't stop for COVID, and so neither do
Mm-hmm.
we. We're not going to stop. Maybe we're not as involved in your day-to-day educating you in these seminars, but like you said, they're handing out pamphlets. They're getting that out to people. They're just doing good in the community, and that
Mm-hmm.
adaptability is it's really inspiring to see so far.
Yeah, it's important for us to stay connected and
Yeah,
present in community.
yeah, and that's awesome. I want to back it up. Didn't touch on this at the beginning, but Kiara Ellis, who are you? And how did you get into this role? I know that you've been in this role for a while and you've been in the healthcare side, but what inspired you to really go down this route?
Yeah, I my educational background is in social work, and so my experience prior to coming to the Cancer Center had always been in social services. So I have been the boots on the ground person doing management work with people, hoping to stabilize their families in whatever way that looks like. And I just grew a real passion for systems change. I wanted to be in a leadership position where we could allocate resources in response to community and approach them in a different way. I think that the foundation of people is a lot family, and whatever that looks like. And so health is a cornerstone of that. Without good health, without access to health care, other pieces of that family unit can crumble, and community can crumble as well. So I'm really passionate about systems change, and cancer affects everyone in lots of ways, not just the patient, but often, the caregiver and the family and the children and community, as a whole. And so just being involved in well-being serves to the passions that I have, but also understanding that in my leadership, I can be thoughtful about the way that we approach community, and change the experience that community has with big institutions like the University of Minnesota. So I think it's really important that, we have folks that have a little bit of both in these kinds of roles. And so what has served us is being able to grow, and the Cancer Center's commitment to providing resources for our team to be out in community, and doing the things that we need to do to share information.
Yeah, and talking about change and just providing opportunities for the community, two big initiatives for community outreach and engagement this year were the mini med school in partnership with the Office of Academical and Clinical Affairs, where that is now available to everyone online, people that weren't able to attend in person. And then MCC Online, this website that the group put together because you couldn't get out there and meet with these people, but it's like, hey, we're going to adapt. We're going to create something that anyone, even if you're not in Minnesota, can get to learn more about cancer and see the great things that we're doing. Tell us about that.
Yeah, so, what our investigators and faculty members, like, the little known secret is that they usually talk to community at a very high level. Not all of us are scientists. No one in my department is, for sure. And so really trying to make sure that we engage our faculty in a way of translating what they're learning into lay audiences. So the mini medical school really does just that. It covers Cancer 101 through survivorship, really trying to break down what's happening, what is the current landscape of cancer in those respective fields, but then also making sure it's in a way that community can actually receive the messages that they're getting. And so it's a great resource for learning and diving deeper into cancer and kind of what's going on in its world. And our MCC Online is a ways. Initially, the idea was to entertain kids too while they're home. Everybody's home, everybody's online. What can we do that's a little bit more fun? And so translating messages into things like our Cancer Fighting Foods program is something really cool. It's summertime. We start talking about gardening and how you incorporate all of these different vegetables and fruits into your diet in fun ways. So the online resource gives you tons of like downloadable activities for kids, for adults, links for just reading literature, and also like music playlists and things like that. So we've tried to be really creative about the way that people engage in education online, and meeting them again where they're at.
Yeah. If you just put, like you said, if you just put some scholarly paper out there, people are going to glaze over in like 3 minutes. And it's just like, I don't like,
Absolutely.
you and I will sit in meetings sometimes and our researchers will talk and it's just like, what?
Yeah. Well,
So putting it in a relatable way. And one of the ways that you did that before, and, I got to give your team so much credit. I had gone out on paternity leave when my son was born, and we had started to work on this thing with TPT, and it was a video series, and two of the videos that we put out were animated, and it was like Cancer 101 and Cancer Fighting Foods. And Kiara and her team, especially Kiara, really led this effort. And if you haven't seen the videos, they are cute, informative, and really cool. And I believe those are on the MCC Online webpage, right?
Yes, they are. And they're short too. So they're not like a really long message, but it talks about our various partnerships and ways that you can engage. Again, like that video project was really fun, and we were able to rope in MNCCTN. So we didn't do it alone. MNCCTN was able to do some education about access to clinical trials. Our CHEN network, the Cancer Health Equity Network, that is a committee of the Minnesota Cancer Alliance, also talked about the importance of our community health workers and their impact in working in community and health too. So it was really cool to tie together some of our work into visuals. Yeah.
Yeah. Very cool. I'm going to change course again. And, as a father of two and someone that owns a small business, I know that COVID for me has been interesting. Really put a spin on things that I wasn't anticipating. How has it been for you? You've got a beautiful daughter. You are a small business owner yourself. How has this kind of changed things for you on a personal level?
I think one thing that I am used to, especially in our kind of work, is being on the go, 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 constantly. This has made us really take pause and reevaluate the way that we approach our day to day, which I think has been a really positive change. Valuing the time that we spend with family and also the flexibility to expose my, daughter to what I do. She's 3, so she might not actually hear it all, but at least she sees like mommy's working, that kind of thing. And then for work, being able to sit with the team and actually strategize, going back through and honoring the work that we've done and what we have planned for the future, and really taking the time to spend and connect with each other and with our partners. So slowing down, I think, has been the best part of COVID, because we need that. And even when we are back to our new normal, I'll say, when we're back to our new normal, like making sure we keep some of those things in place, or we slow down for a while and figure out what our next steps are.
Yeah, kind of a blessing in disguise. Everybody was used to go,
Mm-hmm.
go, go, and now you kind of pause. You get to spend a lot more time with family.
Mm-hmm.
Sometimes that can be a rough thing, but
Yes.
it's all fun. And I always like to end the interviews like this, and it's a very loaded question, and you can take it a personal route, you can take it professional, however you want to. But in this current state of where we are in the world, with how things are going, what gives you hope?
Yeah. What gives me hope is seeing such big movement. I think there's always a question on things, on whether we're in a moment or a movement.
Hmm.
And everything that's going on in our communities and the different areas of, justice or injustice, justice, humanity and people, access and resources, and the need to lean on each other for lots of different things. It gives me hope to see so much change, and so much change in our leadership and the way that they're using their voices. We're seeing, politically, the most diverse groups of folks that are in these positions of power, younger folks, women, people of color, different sexual orientations. All of that is changing the way that we think about policy and impact and all of that. So what gives me hope is just this wave of change and the movements that are happening that really empower people to be active participants in making, a better place for us all.
Yeah, well said. I can't. You said it very well. I don't even have anything to add to that. But that's it for today. Thank you all for joining us. Kiara, thank you so much. This was wonderful. And check us out next time on our next edition of Fields of Study.
Thank you.